Code blue karma. The fork stopped halfway to my mouth when I heard it. Mom's just a nurse, my son Tyler said, laughing. He was 23, home from college for the weekend with his new girlfriend, Ashley. I mean, it's fine and everything, but it's not like she's a real decision maker or anything. I set my fork down carefully. The dining room felt suddenly cold. My husband kept eating. My daughter Emma stared at her plate. Ashley looked uncomfortable, but Tyler just kept going. Like, she helps people, which is great. But doctors make the real calls, you know? Nurses just follow orders. He said it so casually, like he'd been thinking it for years and finally felt comfortable saying it out loud. It's honest work, he added, reaching for more potatoes. But let's be real about what it is. My chest felt tight. I'd worked in healthcare for 27 years. I'd held his hand through every childhood illness, explained every injury, taught him to respect medical professionals. And this is what he thought of me. Excuse me, I said quietly, standing up. I need to make a call. Tyler didn't even look up. Work emergency, he joked to Ashley. Probably someone needs their pillow fluffed. No one at the table said a word in my defense. Not one person. I stood in my bedroom, staring at the wall. My husband knocked once. He didn't mean it like that. Yes, he did. He's just showing off with a girlfriend. You know how he gets. I turned to look at him. And you let him. He had no answer for that. Downstairs, I could hear Tyler's voice carrying from the dining room. More jokes. More laughter. He thought this was funny. Emma appeared in the doorway. She was 19, quieter than her brother.
Mum, I'm sorry.
That was really messed up. Why didn't you say anything? She looked ashamed. I don't know. I froze. At least she felt bad about it. That was something. I went back downstairs long enough to say goodnight. Tyler was on his phone. Barely noticed me leaving. Ashley smiled awkwardly. Early shift tomorrow, I said.
See?
Dedication, Tyler said, not looking up. That's what I respect about nurses. They show up. Like I was a factory worker. Reliable but replaceable. I went to bed at 9:30. I didn't sleep. I kept replaying dinner in my head. The casual dismissal. The confidence in his voice when he reduced my entire career to just something. My phone was on the nightstand. At 11:47 p.m., it rang. Mrs. Patterson? The voice was professional, urgent. This is Mercy General Hospital Emergency Department. Your son Tyler has been admitted following a motor vehicle accident. My heart stopped. Is he? He's stable. Conscious. But we need you to come in. You're listed as his emergency contact. I was out of bed and dressed in 3 minutes. My husband drove while I called for details. Single car accident. Tyler had been driving too fast on a wet road, lost control, hit a guardrail. Airbag deployed. No other vehicles involved. Was he drinking? I asked the nurse on the phone. A pause. That's being evaluated, which meant yes. We reached the hospital at 12:30 a.m. Ashley was already in the waiting room, crying. I told him to slow down. I told him, but he said he had it under control. Of course he did. Tyler always thought he had everything under control. A resident came out to update us. Mild concussion. Bruised ribs. Lacerations requiring stitches. They were admitting him for observation. Can I see him? I asked. Room 347. 3rd floor. I didn't go up immediately. Instead, I walked to the nurse's station and logged into the system using my credentials. Not to interfere. Just to check his status. The chart loaded on the screen. I scanned the admission notes quickly, professionally. Then I saw them. The red flags. Blood alcohol level, 0.09. Just over the legal limit. Admission time, 11:15 p.m. Insurance verification. Incomplete. I clicked into the insurance section. His student health coverage had expired 2 weeks ago. He'd graduated last month, but apparently never told us he'd lost his university plan. And he hadn't enrolled in a new one. Everything okay? A voice behind me made me turn. It was Kyle, one of the night supervisors. We'd worked together for years. Just checking on my son, I said. His expression changed. Tyler Patterson is your son? Yes.
I'm sorry.
I didn't realize. He glanced at the screen. Insurance issue? Seems like it. Kyle nodded slowly. We'll figure it out. But Anna, you should probably recuse yourself from any case management decisions. Conflict of interest. I know. I'm not planning to get involved. But I also wasn't planning to look away. I closed the screen and headed up to his room. Ashley was sitting beside Tyler's bed when I walked in. He looked terrible, bruised, pale, stitches across his forehead. Mom. His voice was small.
Scared.
All the anger I'd felt at dinner evaporated for a moment.
He was still my son.
Still the little boy I'd rocked through nightmares. How do you feel? Like an idiot. That's accurate. I checked his 4-line out of habit. Everything looked good. What were you thinking? I wasn't.
I'm sorry.
He looked at Ashley. I'm sorry to both of you. Ashley wiped her eyes. Your mom can fix this, right? She works here. She can pull strings. I stopped adjusting his blanket. What? Tyler said you know everyone here, that you can make sure he's taken care of. I looked at my son. What exactly did you tell her about what I do? He had the decency to look embarrassed. That you work in patient care. And that you've been here a long time. That people respect you. What did you not tell her? Silence. Ashley looked between us, confused. What's going on? Nothing, Tyler said quickly. Mom, can we talk about this later?
No.
Tell her what I actually do. Before Tyler could answer, a resident walked in with a tablet. Mr. Patterson, I need to go over your discharge instructions. Discharge? Tyler sat up, wincing. I just got here. Standard protocol for your level of injury. We're keeping you overnight for observation, but you'll be released tomorrow morning if there are no complications. Wait, but my head. Mild concussion. We'll monitor you, but most patients go home within 24 hours. The resident started explaining follow-up care. I tried to slip out, but Tyler called after me.
Mom, wait. Can you talk to them?
Tell them I need to stay longer? The resident looked at me for the first time. And you are? His mother. She's a nurse here, Tyler added quickly. She can explain that I need more observation time. The resident's expression changed slightly. A nurse here? Which department? Clinical operations, I said quietly. Oh. The resident's entire demeanor shifted. I apologize, I didn't realize. No apology needed. You're doing everything correctly. Still, if you have concerns about the discharge timeline, I don't. Your protocol is appropriate. I quoted it exactly. Minor traumatic brain injury, without loss of consciousness, GCS 15, normal CT scan, 24-hour observation with discharge if stable. The resident blinked. Yes. Exactly. Tyler stared at me. Mom. The resident looked at me more carefully now. I'm sorry. What did you say your name was?
Anna Patterson.
His eyes widened slightly. You're Anna Patterson? Senior Director of Clinical Operations. Yes. The room went very quiet. After the resident left, Ashley looked at me with new eyes. You're a director? Senior Director. I corrected. I oversee clinical operations for 3 departments, including the ER. Tyler's face had gone pale. I didn't know your exact title. You never ask, but you always said you were a nurse. I am a nurse. That's my foundation. But I haven't worked bedside in 8 years. I kept my voice level. I manage quality assurance, utilization review, and regulatory compliance. I decide which cases meet criteria for admission, which ones need peer review, which ones trigger audits. Ashley's mouth opened slightly. So you're like, in charge? Of some things, yes. Tyler looked sick, and it wasn't from the concussion. I left his room and took the elevator down to the basement. Most people didn't know the administrative wing existed down here. No patients. No visitors. Just offices and conference rooms where the real decisions got made. I badged through 3 security doors. My office was dark. I turned on the light and logged into my computer. The overnight utilization queue loaded automatically. Tyler's name was third on the list. Utilization review. Most people have no idea it exists until it affects them. Every hospital admission gets reviewed to make sure it meets medical necessity criteria. Insurance companies require it. Medicare requires it. If we admit someone who doesn't meet criteria, we don't get paid. If we do it too often, we get audited.
Fined.
Sometimes shut down. I'd been doing utilization review for 6 years. I knew the criteria for every diagnosis code, every procedure, every level of care. Tyler's admission was borderline. Mild concussion. Observation appropriate, but typically 6 to 12 hours, not overnight. Minor lacerations. Could be managed outpatient. Bruised ribs. Pain management. No surgical intervention needed. Blood alcohol level. Complicated things, but he was sober now and medically stable. On paper, he didn't meet criteria for extended inpatient stay. He should be observed until morning and discharged with instructions and follow-up appointments. But there was a complication. I scrolled down to the notes section. His attending physician had already flagged the case. Patient anxious about going home. Requesting extended observation for reassurance. In other words, Tyler wanted to stay longer because he was scared. That wasn't medical necessity. That was preference. My phone buzzed. A text from Tyler. Can you make this go away? Insurance stuff and discharge stuff. Don't embarrass me in front of Ashley. Don't embarrass him. I stared at the message for a long time. Then I put my phone face down on my desk and didn't reply. At 7 a.m., I got called into a meeting with the night shift operations manager. We've got a situation with the Patterson case, he said. The son of our clinical director.
I'm aware.
He's my son.
Oh.
Well, this is awkward. He pulled up the utilization notes. His attending is pushing for extended stay, but the case doesn't meet criteria. Normally, I'd escalate this to you, but given the conflict of interest, I recuse myself from direct case management. I said immediately. But if you need a second opinion on protocol interpretation, I can provide that objectively. Would you?
Yes.
Pull up the criteria. We spent 20 minutes reviewing Tyler's case alongside the clinical guidelines. Every metric pointed the same direction. Discharge after observation period if stable. What if we classify it as social admission, the manager suggested. Patient lacks adequate home support. Does he? Well, his mother works here. Presumably, she could provide appropriate home care. Then it's not a social admission. It's a preference. The manager rubbed his face. His attending is going to push back. Then the attending can document medical justification that meets interqual criteria. If he can do that, we approve extended stay. If he can't, we don't. Even though it's your son? Especially because it's my son. He looked at me for a long moment. Okay, I'll let the attending know. I want to check on Tyler before morning rounds. Tyler was awake, scrolling his phone. Ashley had gone home to change. Did you get my text? He asked. I did. And the answer is no. His face hardened. Seriously? You can't help me out just this once? I'm not refusing to help you. I'm refusing to violate policy. It's just a few extra days. It's insurance fraud, I said quietly. If I approve a stay that doesn't meet medical necessity, the hospital gets audited. If they find a pattern, we lose our Medicare certification. If I approve it for you specifically, I lose my job and possibly my license. No one would know. Everyone would know. Tyler, there's an audit trail on every decision I make. Every signature is logged. Every override is tracked. I sat down in the visitor's chair. You think I became senior director by cutting corners? I think you became senior director by following rules so carefully you forgot about being human. That stung. Being human doesn't mean ignoring rules that protect patients. I'm not a patient. I'm your son. Right now you're both. He looked away, jaw tight. This is because of what I said at dinner.
No.
This is because of hospital policy that existed long before last night. I don't believe you. That's your choice. But the answer doesn't change. His attending physician knocked and came in. Dr. Pierce, a young ER doctor I'd worked with a few times. Good morning. How are you feeling, Tyler? Like I need to stay here longer. Dr. Pierce glanced at me. Mrs. Patterson, might I speak with you outside? In the hallway, Dr. Pierce kept his voice low. I put in a request for extended observation. 48 hours instead of 24. On what grounds? Patient anxiety, and he hesitated. Look, he's your son. I thought you'd want us to be cautious. I want you to be appropriate. What's your clinical justification? Mild concussion can have delayed symptoms, which we monitor through outpatient follow-up, not extended admission. What else? He looked uncomfortable. He's anxious about managing his injuries at home. Is he cognitively impaired?
No.
Does he have adequate support at home? You're his mother and you're a healthcare professional, so yes. Then he doesn't meet criteria. I kept my voice professional. Dr. Pierce, if you approve extended stay for every patient who's anxious about going home, you'll have a full hospital and no revenue. I thought you'd want me to approve it. As his mother or as clinical director? He blinked. Is there a difference?
Yes.
As his mother, I want him safe. As clinical director, I want him safely managed according to evidence-based protocols. I paused. If you believe there's medical necessity for extended stay, document it. List the clinical indicators. Cite the guidelines. Make your case. And if I do, then it gets reviewed objectively by someone other than me because I've recused myself. But you're still involved, only to ensure policy is followed correctly, not to make exceptions. I met his eyes. Put it in writing, Dr. Pierce. Everything you just told me. Make it official. He looked deeply uncomfortable now. I'll review his chart again. He walked away.
I knew what that meant.
He wasn't going to put it in writing because he couldn't justify it medically, which meant Tyler was going home tomorrow. Ashley returned mid-morning with coffee and breakfast. She found me in the cafeteria, sitting alone. Can I talk to you? She asked. Of course. She sat down, nervous. I overheard some nurses talking earlier. They were saying Tyler's stay might not be approved. That insurance won't cover it. That's possible. Can't you do something? Tyler said you have authority here.
Ida.
And that authority requires me to follow the same rules as everyone else. But you're his mother. Which is exactly why I can't make exceptions. If I override policy for my own son, what does that say about my integrity? Ashley looked confused. It says you love him.
No.
It says I'm willing to commit fraud for him. There's a difference. Fraud? It's just hospital administration. It's Medicare fraud if we bill for services that aren't medically necessary. It's insurance fraud if we misrepresent the reason for admission. People go to prison for this, Ashley. I softened my voice. I understand Tyler's scared. But being scared isn't a medical diagnosis. He's stable enough to go home with monitoring and follow-up. That's not punishment. That's appropriate care. She processed this. He's really upset with you. I know. He says you're enjoying this. I closed my eyes for a moment. I'm not enjoying this.
I'm doing my job.
But he's your son.
Yes.
And if I loved him less, maybe I'd give him what he wants instead of what's right. She didn't understand. Not yet. But she was starting to look at the situation differently. By afternoon, she'd heard more conversations. Overheard more explanations from staff. She was beginning to realize I wasn't the one blocking anything. Policy was. Tyler called me at 3 p.m. I was in a budget meeting. Mom, Ashley told me what you said. About fraud and prison and all that. It's true. You're making this sound worse than it is. Am I? Pull up the Federal False Claims Act. Read what happens to healthcare administrators who approve medically unnecessary services. Silence. Then, I just want one more day. Why? Because I'm scared, okay? I feel like crap, my head hurts, and I don't want to be alone if something goes wrong. My heart broke a little. Tyler, I understand. But you won't be alone. Dad will be with you. Emma will help. I'll check on you between shifts. We'll follow all the discharge instructions. You'll have a follow-up appointment in 3 days. It's not the same as being in a hospital.
No.
It's better. You'll rest in your own bed. Eat real food. Recover without getting woken up every 2 hours for vital signs. What if something happens? Then we'll bring you back. But statistically, nothing will happen. Your injuries are minor, Tyler. You're lucky. I don't feel lucky. You drove drunk and walked away with stitches. Trust me, you're lucky. I kept my voice gentle but firm. The hospital isn't a hotel. It's for people who need acute medical intervention. You don't anymore. You sound like a robot. I sound like someone who's done this for 27 years. He hung up on me. At 6 p.m., his attending officially withdrew the request for extended stay. At 7 p.m., Tyler was officially scheduled for discharge the next morning. At 8 p.m., I got a call from Ashley.
He's really angry.
He's saying things about you. What kind of things? She hesitated. That you've always been cold. That you care more about your job than your family. That you're enjoying making him suffer. And what do you think? Long pause. I think I don't understand how hospitals work. That was honest, at least. Ashley, can I ask you something?
Sure.
Last night at dinner, Tyler called me just a nurse. Did you know that hurt me? Silence. I thought you didn't hear it. I heard it. I just didn't react.
I'm sorry.
I didn't say anything because you didn't know me well enough to defend me. I understand. But now you know more about what I actually do. So I'll ask you, am I just anything? Her voice was quiet.
No.
Remember that tomorrow. Morning rounds happened at 6:30 a.m. Tyler's case was reviewed clinically, unemotionally. All metrics supported discharge. The decision came to me because I was the final approver in the utilization review chain. Even though I'd recused myself from direct case management, hospital policy required my signature on any discharge against physician preference. Dr. Pierce had ultimately supported the discharge, but he noted family preference for extended stay in his documentation, which meant the final decision would have my name on it. I looked at the discharge approval form on my screen. One signature, and Tyler would be released at 10 a.m. with full instructions, prescriptions, and follow-up appointments. He'd be safe. He'd be monitored. He'd recover. But he'd be angry. I thought about dinner. About just a nurse. About years of dismissing what I did, who I was, what I'd accomplished. Then I thought about the oath I took, the license I held, the responsibility I carried. I signed the form. The system auto-notified the care team immediately. At 7:15 a.m., my phone rang.
Tyler.
You actually did it. His voice shook with disbelief. You're actually kicking me out. I'm discharging you according to protocol. That's not kicking you out. Same thing.
No, Tyler.
It's not. I was in my office, door closed. Kicking you out would be sending you home without instructions or follow-up. What's happening is you're being discharged with a complete care plan, medications, and scheduled appointments. I can't believe you. What did you expect? I expected my mother to care more about me than her stupid rules. I care about you more than you understand, which is why I'm not teaching you that rules don't apply to you. Because they do. They apply to everyone. You're punishing me? For what? The accident?
No.
That was a consequence of your own choices. This discharge? This is standard medical care. It has nothing to do with punishment. It has everything to do with what I said at dinner. You think I'd violate federal healthcare law because you hurt my feelings? Tyler, you don't know me at all. I kept my voice steady. If I wanted revenge, I'd do nothing. Let you stay extra days. Let you run up bills your insurance won't cover. Let you figure out on your own how much those stitches and that CT scan cost without coverage. Silence. But I didn't do that. I signed off on a medically appropriate discharge that protects you and follows the law. That's what mothers do, even when their sons call them just a nurse. Can you undo it? Can I?
Yes. Will I? No.
Please. You told me I'm not a real decision maker. You said I just follow orders. So this should be easy for you, right? It's just policy. I'm just following orders. His breath caught. Discharge is at 10 a.m. Dad, we'll pick you up. Follow the instructions. Take the medications. Come to your follow-up. You'll be fine. I hung up before he could respond. At 9 a.m., I ran into Kyle in the hallway. Patterson case is finalized, he asked.
Yes.
Discharge at 10. He studied my face. That couldn't have been easy. It was the right call. Still. He hesitated. For what it's worth, you handled it exactly right. By the book. No one can question it. Someone will.
Let them.
You've got documentation to back every decision. At 9:45, I went up to Tyler's room. He was dressed, sitting on the edge of the bed. Ashley was packing his things. Dad's on his way, I said. Tyler didn't look at me. I need you to sign your discharge papers and medication reconciliation forms. He took the papers from me and signed them without reading. Tyler, you need to actually read.
Why?
You already made all the decisions. Because you need to understand your follow-up care. You have appointments scheduled. I'll figure out. Ashley touched his arm. Tyler, let your mom explain. She's not my mom right now. She's Clinical Director Patterson. She made that very clear. I set the papers on his bedside table. The instructions are in the folder. Prescription is being filled in the hospital pharmacy. Pick it up on your way out. I turned to leave. Ashley stopped me. Mrs. Patterson? I looked back. Thank you. She said it quietly but firmly. For everything. Tyler stared at her. What? Your mom did her job. She did it right. I get it now. He looked betrayed. You're taking her side? I'm not taking sides. I'm just saying she could have done a lot of things wrong here. And she didn't. The car ride home was silent, according to my husband. Tyler sat in the back seat like a sulking child. He wouldn't speak. Wouldn't make eye contact. Went straight to his room when they got home. I didn't get home until 7 p.m. Another 12-hour shift. When I walked in, Emma was sitting at the kitchen table. He's been in his room all day, she said. Won't come out. Won't eat. He's 23. He can handle being mad at me. Mom, he's really upset. Good. Maybe he'll think before he dismisses people next time. Emma looked surprised. You're still angry about dinner. I'm not angry.
I'm disappointed.
There's a difference. I poured water into a glass. He thought I was powerless. Insignificant. Just a nurse. But the moment he needed something, he expected me to fix it. You see the contradiction? I do now. Do you know what I actually do, Emma? My real job. She looked embarrassed. I know you work at the hospital. Administrative stuff. I oversee clinical operations for 3 departments. I manage a budget of $42 million. I make decisions that affect hundreds of patients every day. I've testified in medical malpractice cases. I've redesigned emergency protocols that have been adopted statewide. I took a breath. But your brother thinks I'm just a nurse. Like I take blood pressure and fluff pillows. He didn't know, because he never asked. In 23 years, he never once asked me what I actually do. He made assumptions. And when those assumptions benefited him, he was happy to use them. But when they didn't, I gestured toward his room. This. Emma was quiet for a moment. What are you going to do? Nothing. He can come talk to me when he's ready. What if he doesn't? Then he doesn't. I can't force respect, Emma. He either learns it or he doesn't. Upstairs, I heard Tyler's door open. Then footsteps down the stairs. Tyler appeared in the kitchen doorway. He looked terrible, pale, exhausted, still bruised. Can we talk? He asked quietly. Sit down. He sat across from me. Emma quietly left the room. For a long moment, neither of us spoke. I've been thinking about what you said, Tyler finally started. About rules applying to everyone. And I'm still mad. But Ashley made me look up what you actually do. Your job title. Your responsibilities. He looked down at his hands. I didn't know. I thought you just worked in patient care. I do work in patient care. I just do it differently than bedside nurses. Why didn't you tell me? I did. Many times. You weren't interested. I kept my voice level. Every time I came home and talked about work, you tuned out. Every time I tried to explain a case or a policy issue, you changed the subject. So I stopped trying. I'm sorry. For which part? For not knowing? Or for calling me just a nurse in front of your girlfriend? He flinched. Both. Tyler, I need you to understand something. I'm not hurt because you got my job wrong. I'm hurt because you dismissed it without even trying to understand it. You reduced my entire career to something insignificant because it was easier than respecting what you didn't understand. I know.
Do you?
Because this morning you told me I care more about rules than you. But those rules? They protect patients. They prevent fraud. They ensure fair treatment. They're not arbitrary. They exist for reasons. I leaned forward. And yes, sometimes those rules are inconvenient. Sometimes they feel harsh. But they apply to everyone equally, including my son. You could have made an exception. And then what? What would I have taught you? That consequences don't apply to you? That rules can be bent if you know the right people. I shook my head. I love you too much to teach you that. His eyes filled with tears. I was scared. I know. But being scared doesn't mean you get special treatment. It means you get appropriate care and support, which is exactly what you got. He wiped his face. I really am sorry for what I said at dinner, for how I treated you. Apology noted. That's it. What else do you want? You hurt me, Tyler. An apology doesn't undo that immediately. So you're still mad. I'm still disappointed. There's a difference. Over the next few days, something shifted. Tyler stayed home, recovering. He followed his discharge instructions carefully, probably because he realized what happened if he didn't. He took his medications on schedule, went to his follow-up appointments, and he started asking questions. What's utilization review? He asked at breakfast on day 3. I explained it. He actually listened. How do you decide what's medically necessary? I walked him through the criteria, the guidelines, the audit processes. Have you ever been wrong? Of course. That's why we have peer review. When there's a gray area, multiple people weigh in. Did multiple people review my case?
Yes.
3 different reviewers plus your attending physician. Everyone agreed on the discharge timeline. Even though I wanted to stay, patient preference is considered. But it doesn't override medical necessity. I paused. Tyler, if we approved every extended stay that patients wanted, we'd go bankrupt and close. Then no one would have emergency care. He processed this. I never thought about it like that. Most people don't. Until they have to. By day 5, he was asking about my career. How I started. How I advanced. What I'd accomplished. I told him about implementing our sepsis protocol that reduced mortality by 18%. About testifying in a lawsuit that changed how restraints are used statewide. About training programs I developed that improved new hire retention. You've done all that? He asked, genuinely surprised. Yes. And I called you just a nurse. You did. He looked ashamed. I'm an idiot. You're young. There's a difference. But you can't stay young forever. On day 7, he asked the question I'd been waiting for. Why didn't you ever tell me I was being disrespectful? I did tell you, I said. Many times. You just didn't hear it. When? Every time you interrupted me when I was talking about work. Every time you made jokes about nurses. Every time you implied that only doctors make real decisions. I poured coffee. I'd correct you. You'd laugh it off. Eventually, I stopped correcting you. That's on me.
Yes.
But it's also on me for not being more direct. For not sitting you down and explicitly saying, this hurts. This is disrespectful. Stop. Why didn't you? Because I hoped you'd figure it out on your own. That you'd mature enough to see it. I looked at him. And maybe because part of me believed what you said. That I was just a nurse. That my work didn't matter as much as other professions. Do you still believe that?
No.
But it took me years to stop believing it. I don't want you to waste years believing lies about yourself or others. Tyler was quiet for a long time. What you did at the hospital, discharging me when you could have kept me longer, was that to teach me a lesson?
No.
It was to follow protocol. But yes, I hoped you'd learn from it. Did I? What do you think? He considered. I think I learned that power isn't always loud. Sometimes it's quiet. Sometimes it's just signing a form at the right time for the right reasons. I smiled. That's exactly right. And I learned that respect isn't automatic, not even in families. Especially not in families. We take family for granted. We assume they'll always be there, always forgive us, always help us. And they usually will. But that doesn't mean we shouldn't earn their respect. I didn't earn yours. Not at that dinner, no. Do I have it now? You're working on it. He nodded slowly. Fair enough. 2 weeks after the accident, Tyler's stitches came out. His bruises faded. His headache stopped. He was cleared to return to normal activities. But something had changed. He didn't go back to his apartment right away.
He stayed home.
Helped around the house. Had actual conversations with me about work, life, and everything else. Emma noticed. He's different, she said. He's growing up. Better late than never. One afternoon, Tyler came to find me in my home office. Can I ask you something? Always. When you were discharging me, and I was being awful to you on the phone, did you want to change your mind? I thought about it. For a second. But then I remembered why I became a nurse in the first place. Why? Because I wanted to help people. Really help them. Not just make them comfortable or give them what they wanted, but actually help them get better. Make better choices. Understand their own health. I looked at him. Sometimes helping means saying no. Especially when someone wants the wrong thing. I wanted the wrong thing. You wanted the easy thing. There's a difference. But easy isn't always right. The discharge was the right thing? Medically, legally, and ethically?
Yes.
Absolutely. I paused. Personally, it was the hardest signature I've ever written. But it was still right. I'm sorry I made you choose. You didn't make me choose. You just didn't like that my job came with responsibilities I couldn't ignore. He was quiet. Then, I told some family members what happened. My version, which was that you refused to help me, that you were being cold and professional instead of being my mom. My stomach tightened, and they believed me, called you heartless, said you cared more about hospital politics than your own son. I see. But I corrected them. I looked up, surprised. I called everyone back, told them the real story, what I said at dinner. How I was wrong. How you did your job exactly right, even though it was hard. His voice was steady. I told them you're not heartless. You're just honest. And maybe that's what I needed. Tyler. I'm not done. He took a breath. I'm going to tell everyone. Anyone who heard the first version gets the second one. Because I was wrong. And they should know that. I felt something loosen in my chest. Pride, maybe. Or relief. Thank you. It's the least I can do. The following Sunday, we had another family dinner. Same table. Same people. But everything felt different. Tyler's girlfriend, Ashley, was there again. So was Emma, my husband, 2 of my sisters and their spouses. The people who'd heard Tyler's initial version of the story. Everyone was carefully polite. No one mentioned the hospital, the accident, the discharge, until Tyler set down his fork. I need to say something, he announced. The table went quiet. A few weeks ago, I said something really disrespectful about Mom. Some of you heard about it. And then when I was in the hospital, I told some of you that she refused to help me, that she chose her job over me. He looked around the table. I was wrong. About all of it. My sister Catherine raised her eyebrows. Tyler. No, let me finish. I called Mom just a nurse. Like that was nothing. Like her job didn't matter. But she's not just anything. She's Senior Director of Clinical Operations at Mercy General. She oversees millions of dollars in hospital operations. She makes decisions that affect hundreds of patients. He looked at me. And when I needed special treatment, she refused. Not because she doesn't love me, but because she loves me enough to treat me fairly. The table was silent. She discharged me from the hospital when I wanted to stay longer. She followed the rules, even though I'm her son.
And I was angry about it.
But now I understand.
His voice was steady.
She taught me that respect isn't automatic, that rules apply to everyone, and that being a nurse, being any kind of healthcare worker, is about helping people, not making them comfortable. Ashley squeezed his hand. So I'm sorry, Mom.
For what I said.
For how I acted. And I'm sorry to everyone here for misrepresenting what happened. He looked around the table. My mom isn't cold. She's professional. And that's something I should have respected years ago.
No one knew what to say.
Finally, I spoke. Thank you, Tyler. That means more than you know. He nodded. My sister Catherine cleared her throat. I owe you an apology too, Anna. I said some things when Tyler first told me his version.
I'm sorry.
So did I, my other sister admitted. I thought you were being harsh. I was being appropriate, I said quietly. There's a difference. We see that now. The dinner continued. Conversations resumed. But something had shifted. People asked me about my work. Really asked. Listened to the answers. Showed genuine interest. For the first time in years, I felt seen by my own family. After dinner, Tyler and I did dishes together. Just the two of us in the kitchen. That was brave, I said. What you did out there. It was necessary. Still brave. He rinsed a plate carefully. Can I ask you something? Of course. Are you proud of me? I stopped washing and looked at him. Really looked at him. Yes, I said. Not because you apologized. Anyone can apologize. But because you learned something hard and changed your thinking. That's growth. That's maturity. I almost didn't do it. The apology, it would have been easier to just let people think what they wanted. But you did it anyway. That's character. He smiled a little. I learned from the best. Your father? You. He dried another plate. You signed that discharge form knowing I'd hate you for it. You did the right thing even when it was hard. Even when it hurt. That's who I want to be. My throat got tight. You're getting there. Really? Really? You made a mistake. You owned it. You corrected it. That's exactly what you're supposed to do. I handed him another plate. I'm proud of you, Tyler. For who you're becoming. He didn't say anything. Just kept drying dishes. But I saw him wipe his eyes. Over the next few weeks, Tyler changed. He researched healthcare careers. Asked about nursing programs. Wanted to understand the field he dismissed so easily. I'm not saying I want to be a nurse, he clarified. But I want to understand it better. Respect it better. That's all I ever wanted. He also started paying attention when I talked about work. Asked questions. Engaged genuinely. One evening, he asked about the hardest decision I'd ever made. Other than discharging you? I smiled. Other than that. I told him about a case from 5 years ago. A young patient who needed surgery that insurance wouldn't cover. The family begged me to override the denial. To find a way around the rules. What did you do? I helped them file an appeal. Walked them through the process. Connected them with advocacy resources. But I couldn't override the insurance decision. That wasn't my authority. Did they get the surgery? Eventually. After a 3-month appeal process.
But yes.
Were they angry at you? Furious. At first. They thought I could have done more. Fixed it faster. But I explained what I could and couldn't do. The limits of my authority. The rules I had to follow. Did they ever understand? The father did. He called me 6 months later to apologize. Said he'd been desperate and took it out on me. But he appreciated that I'd been honest about what was possible. Tyler processed this. So even when people hate you for following the rules, sometimes they come around. Sometimes. Not always. But that can't change what you do. You have to make decisions based on what's right, not on whether people will like you for it. That's lonely. Sometimes. But it's also honest. He nodded slowly. I think I'm starting to understand what power actually means. Tell me. It's not about doing whatever you want. It's about being responsible even when no one's watching. Especially when no one's watching. I smiled. Now you're getting it. A month after the accident, I found Tyler in the kitchen reading something on his laptop. What's that? I asked. Job applications. Healthcare administration positions. Entry-level stuff. I looked over his shoulder. You're serious about this? I think so. I mean, I have a business degree. It could work. He glanced up at me. Would that be weird? If I ended up in the same field? Weird?
No.
Surprising? A little. I just keep thinking about what you said.
About helping people.
Really helping them, not just giving them what they want. He closed the laptop. I think I want to do that. It's not easy. Neither was getting discharged by my own mother. He grinned. But I survived. You did more than survive. You learned. Thanks to you. He was quiet for a moment. Can I tell you something? Always. When you signed that discharge form, I thought you were trying to hurt me, to punish me for what I said at dinner. But now I realize you were protecting me. From what? From becoming someone who thinks rules don't apply to him. Someone who uses connections instead of earning things. He looked at me seriously. If you'd bent the rules for me, I would have learned that I could get away with anything. That being your son meant special treatment. And now I know that being your son means higher standards, not lower ones. I felt tears prick my eyes. Tyler, I'm serious. You taught me that respect isn't about titles or positions. It's about how you treat people and how you do your job. And I'm sorry it took me so long to learn that. He stood up and hugged me. Really hugged me, the way he used to when he was little. I love you, Mom. Not just a nurse mom. Senior Director Clinical Operations mom. The mom who signs discharge papers and follows rules and does the right thing even when it's hard. I hugged him back. I love you too. When he pulled away, he was smiling. So, want to help me with this application? Absolutely. But I'm going to be honest about your qualifications. I wouldn't expect anything less. We sat down together and worked through his application. He listened to my advice, asked smart questions, showed real interest. And I realized he finally saw me, not just a nurse, not even just his mother, but as a professional, a leader, someone worth respecting. He'd called me just a nurse at dinner. The next day, I signed his discharge, not to punish him, not to prove a point, but to show him what those words actually meant. And somehow, against all odds, he learned the lesson. That just a nurse is never just anything. It's everything.